Assalamu alaikum. My name is Dr. Zujajat here, and I'm going to be telling you about anatomy and embryology of the eye. To make this course manageable, we're going to break down this lecture into anatomy of the external structures around the eye, anatomy of the orbit, anatomy of the eyeball itself, and a little bit of embryology, hopefully not too overwhelming, and some that should be relevant to what you might see, with some clinical cases that I will discuss. First, let's talk about the external anatomy, mainly the basic muscles of the face around the eye. The orbicularis muscle is around the eyeball, and then in front of the eyelids is the orbicularis oculi. So the orbicularis, and then the part of it that's in front of the eye is the orbicularis oculi. These help to open the eyelids and also maintain structure around the eye. When these muscles start to sag, people develop baggy eyes, wrinkles, drooping eyelids. And then we have the corrugator and procerus muscle. These are the muscles of facial expression. If you scrunch up your procerus muscle, then you will get horizontal lines along your forehead. If you are trying to activate your corrugator muscle, then you will cause vertical lines to appear between your eyebrows. For example, when we get angry or when we're concentrating. If someone is having bagginess under their eyes or wrinkles or sagging of the face, surgery of the orbicularis muscle will help to lift the face, which is commonly done by facial plastic surgeons, ophthalmologists, oculoplastic surgeons, as well as maxillofacial surgeons. The procerus muscle and the corrugator muscle can cause lines along the forehead, particularly if someone is overly using those muscles, and Botox is used to relax those muscles and paralyze them, and therefore straighten out those lines. Next, we come to the tear-producing and tear-draining organs. The first is the lacrimal gland, or the tear gland. It is tucked away under the orbital bone, and it produces tears that then mix with mucus created by the conjunctiva. The conjunctiva is a lining on the white part of the eye, and it has goblet cells that produces mucus. These tears and mucus then mixed with oils that are made by the meibomian glands. The meibomian glands are pores that are in our upper and lower eyelid next to the eyelashes, and just like the pores in our skin produce oils, the meibomian glands also produce oils. This mixture of water, mucus, and oil coats the surface of our eye and is the primary refracting power of the eye. What I mean by that is when light hits our eye, it is focused, sharpened onto the retina to create an image, a clear image. People think it's the lens that does the focusing, but actually the lens is the least powerful focusing mechanism inside our eye. The tear film on the surface of the eye does the primary focusing work. That's why if people have dry eyes, they will have blurry vision because they are not able to focus light properly. Also, people will complain of blurriness if they're using their computer for a long time, or using their phones, or watching TV for a long time, or reading for a long time. That is because as they focus and don't blink as much, the tear film evaporates away, and without a healthy tear film, it is hard to focus light properly, thereby causing blurry vision. These tears have to be recycled, and that is done through the tear drainage system. First, the tears go into the puncta, which are two small openings in the upper and lower eyelid, right next to our nose. The tears travel through there through the canaliculi, and then to the primary lacrimal duct. These structures are all very delicate and have to be protected, and we will discuss later the anatomy that protects these structures, and also they are susceptible to diseases, tumors, inflammation. This is a person with inflammation of the lacrimal gland. It has gotten so big that it is visible under the eyelid and on the surface of the eye, even though typically the lacrimal gland is not visible. Sarcoidosis is an inflammatory condition that can affect the lacrimal gland and the conjunctiva and cause swelling like this. Let's talk about the structures that help protect all this soft, fleshy tissue. The bones of the orbit can feel a little bit overwhelming, but there is a way to make sense of all of this. The job of the orbital bones is to protect the very delicate eye, the lacrimal gland, the tear duct, and all the muscles and nerves that come into and attach to the eye. Foremost, we have to protect the top of the eye from the brain. This separation is called the orbital roof. The roof of the orbit is made of the frontal bone, which protects the forehead and the top of the eye, and also the greater wing of the sphenoid and the lesser wing of the sphenoid. So the sphenoid bone here is in green, and as you can see, there is this wedge running through it. That's what separates the greater wing, the bigger one, from the lesser wing, the smaller one. This is a very important wedge that we'll talk about later, but understand that's why there are these two wings. So the frontal bone, greater wing of the sphenoid, and lesser wing of the sphenoid are the roof. Next, let's talk about the floor. The floor of the orbit is made of the maxillary bone and also the tiny palatine bone. The maxillary bone not only protects the bottom of the eye, but also comprises the front of the cheek and protects our maxillary sinus. This is frequently injured when people have blunt trauma. So we've talked about the roof and we've talked about the floor. So let's talk about the side walls. On the side of the nose, we have a bone that separates the nose from the eye. That's the ethmoid bone. The ethmoid bone has pores that in childhood allow material to potentially seed from the nose to the eye, which can cause infections into the eye. So that is the clinical relevance of the ethmoid bone. There's also the lacrimal bone. Remember I mentioned that the structures around the eye are very delicate? Well, the lacrimal bone houses this delicate structure of the nasolacrimal duct. And now we get to the temporal bone, which is on the side of the ear. This is one major bony structure, the zygomatic bone. It's very strong. If someone has a fracture of the zygomatic bone, it means that they have endured a very severe blunt trauma. This is an MRI of someone who developed a fracture of the orbital roof. So what bones are in the orbital roof? The frontal bone, greater wing of the sphenoid, and lesser wing of the sphenoid. The sphenoid bones are further back, so if someone is injured head on, most likely the frontal bone would be the one in the roof to be damaged. So this person has a fracture of the frontal bone. This would need to be repaired to prevent any damage to the brain by a neurosurgeon. Next, if you look to your right side, you will see a fracture on this MRI of the maxillary bone, the orbital floor. On the left side, the maxillary sinus is black because it's filled with air and the eye is above that. But on the right side, that space is filled with gray matter, which is blood, tissue, and the eye is a little bit inferiorly displaced because there's nothing supporting it on the bottom. So this is a maxillary bone fracture. We also call it a blowout fracture. Here is a problem with the nasal wall of the orbit. This person had a sinus infection in their ethmoid sinus, along and behind the nose, and some of the bacteria got through the bone and got into the nasal orbit through the ethmoid bone. And as you can see, it's created this little lump, which is pus and bacteria. And as that lump gets bigger and bigger, it can compress on the eyeball, causing orbital cellulitis, or an infection that can cause irreversible vision loss. This is a patient with a temporal fracture. So a fracture of the temporal side would cause damage to the zygomatic bone, and that typically requires very severe injury. Next, we get to the muscles and the nerves that are supported by these bones. There are multiple cranial nerves that come into the eye. There's the lacrimal nerve, the frontal nerve, and the trochlear nerve that go through that little wedge I mentioned before between the greater wing of the sphenoid and the lesser wing of the sphenoid. Then we have this little circle where the muscles of the eye originate from. They're all fused in the back, and then they separate and come to the front and attach onto the eye. Through this circle where these muscles originate, there are some very important nerves that come out. The optic nerve, which is the nerve that sees, and the ophthalmic artery comes out of the optic nerve. Then there are some other nerves that also come through that opening. The oculomotor nerve, its superior and inferior branch, the abducens nerve, and the nasociliary nerve. The oculomotor nerve moves some of the muscles of the eye, the abducens nerve moves a muscle of the eye, and the trochlear nerve moves some muscles of the eye. The lacrimal, frontal, and nasociliary nerve are branches of the trigeminal nerve, which is a sensory nerve. The trochlear, oculomotor, and abducens nerve are motor nerves, so they help to move things. The lacrimal, frontal, and nasociliary, for ease, are part of the trigeminal nerve, and they help with sensation. Then you have the ophthalmic veins, the superior and inferior ophthalmic veins, which help drain blood out of the orbit. The muscles of the eye are the four cardinal muscles that go up, down, side to side, and then the muscles that help rotate the eye, the superior oblique and the inferior oblique. So the muscles originate from the cone, which is called the annulus of Zinn, and then as they come forward, they attach in different areas. The superior rectus and inferior rectus work together to look up and down. The medial rectus near the nose and the lateral rectus near the ear help the eye to look side to side. And the superior oblique and inferior oblique help to rotate the eye. One of the most common problems that you might see of someone whose muscles are misaligned is strabismus, where children can have misalignment of their eyes, and it requires muscle surgery to fix it. This is a person who had that orbital floor fracture, and what bone is injured in an orbital floor fracture? The maxillary bone. If the maxillary bone develops a crack or a break, because the inferior rectus, the muscle on the bottom of the eye, is right next to the floor, that inferior rectus can get stuck in the fracture, and then if someone tries to look up, they can't look up because the muscle is trapped. So in this case, this patient is being asked to look up, and in their left eye, they look up, but their right eye, the muscle is caught, and so they can't look up. Now let's talk about anatomy of the eyeball itself. There's a lot that is not relevant for your purposes, but I will just discuss some things that are very common and noticeable. This is a person who has a cataract, the lens inside their eye is a little bit cloudy. When the lens becomes cloudy, we call it a cataract. Their iris is brown colored. The pupil is dilated. That's why you can see so much of the lens. And the lens and the iris are actually covered by a clear layer called the cornea. Most people that you might meet don't know that the cornea exists, but the cornea is covering the iris and the lens. Then the white part of the eye, which is the sclera, also has the covering that is clear called the conjunctiva. Some people can have a brownish color to the conjunctiva, typically people who are darker skinned. And the sclera is usually white and has red blood vessels running through it. This is a sideways view of the eye, so you can see all of those structures. There's the cornea, the clear window on the front of the eye, then the iris, which is a circular structure, and then the lens is in the back of the eye. It's shaped like an M&M. The yellow dashed line you see in the picture shows how the fluid inside the eye circulates. It's produced by the muscles next to the lens, and then eventually it is drained out in front of the iris through small little drainage channels in front of the iris. You might see a patient who comes in with a red eye. The redness can be from the conjunctiva, or it can be on the sclera, and it typically requires an ophthalmic exam to find the difference. This is typically not a structure that you will be seeing as part of your practice, but it's important to know that inside the eye, the inner lining of the eye is made up of the retina, which is like the film inside a camera. The optic nerve is visible as a round yellow circle, which has blood vessels coming out of it. Next to the optic nerve is an important area of the retina that we call the macula. The macula is important because that is the area that is responsible for our high sensitivity vision and color vision. It is what helps us to read, recognize people. And then the rest of the retina has lower sensitivity and does not see as clearly, but is important for peripheral vision. Let's talk a little bit about embryology. The main things you need to know is that the eye is derived from multiple embryologic layers. There are parts of the eye that are derived from the neural crest cells. These are the same cells that are involved in developing the nervous system. There are also parts of the eye that are derived from the ectoderm, the layer that produces the skin. And then there are parts of the eye that are produced from the mesoderm layer. The mesoderm layer is what helps to create soft tissue and muscles in our body. That is why even though it is just one organ, it is very complex and has multiple structures to it because it derives from multiple embryologic layers. This is a patient who had a failure of development of the ectodermal layer. So the eyelid skin did not fully develop. This is a person who had a failure in the fusion of the neural crest cells and the ectoderm, leading to an opening in their iris. It did not close all the way, and so therefore that part is missing. This is a person who has a tumor of neural crest cells. A neuroblastoma is a tumor of neural crest cells. Inside the eye, as this tumor grows, it compresses on the optic nerve and the eyeball and can cause irreversible vision loss. It's not necessarily that important to know embryology, but it does help us to understand what is the origin of the diseases that can, in the future, affect the eye.